Today we're tackling a topic that's both important and often misunderstood: the relationship between masturbation and prostate health. There's a lot of misinformation out there, so let's separate fact from fiction with evidence-based information. This video is educational content for adults. If you're under 18, please discuss these topics with a parent or healthcare provider. Understanding the prostate first, let's talk about what the prostate actually is. The prostate is a walnut-sized gland that's part of the male reproductive system. It sits below the bladder and surrounds the urethra, the tube that carries urine and semen out of the body. The prostate produces prostatic fluid, which makes up about 30% of semen. This fluid helps nourish and protect sperm. As men age, the prostate naturally grows larger, which can sometimes lead to issues like benign prostatic hyperplasia or BPH. Common prostate problems include benign prostatic hyperplasia, enlarged prostate, inflammation, prostate cancer. The research on masturbation and prostate health now. Let's dive into what science actually tells us about masturbation and prostate health. 1. Masturbation causes prostate problems. This is false. There's no scientific evidence that masturbation causes prostate issues. In fact, research suggests the opposite might be true. The potential benefits? A landmark 2016 study published in European Urology followed nearly 32,000 men for 18 years. The researchers found that men who ejaculated 21 or more times per month had a 20% lower risk of developing prostate cancer compared to those who ejaculated 4 to 7 times per month. But before you get too excited about these numbers, it's important to understand what this means and doesn't mean. What the research suggests, regular ejaculation may help flush out potentially harmful substances from the prostate. It might reduce inflammation, could help prevent the buildup of carcinogenic secretions. Important caveats. This is correlation, not causation. The protective effect was most pronounced in older men. Quality of life and overall health habits matter more than frequency alone. Individual results will vary. Addressing common worries and misconceptions. Let's address some common worries and misconceptions. Will frequent masturbation weaken me? No. This is an old myth with no scientific basis. Masturbation doesn't cause physical weakness, blindness, hairy palms, or any of the other myths you might have heard. What about prostatitis? Some men worry that masturbation causes prostatitis, prostate inflammation. While excessive or rough stimulation could potentially cause temporary irritation, normal masturbation doesn't cause chronic prostatitis. In fact, ejaculation can sometimes help relieve symptoms of chronic prostatitis by helping drain the prostate. Is there such a thing as too much? Like anything, balance is key. If masturbation interferes with daily life, relationships, or causes physical discomfort, it might be worth discussing with a healthcare provider. But for most men, normal masturbation habits are perfectly healthy. What really matters for prostate health? 7 o'clock, 9 o'clock. While we're talking about masturbation, let's not lose sight of what really impacts prostate health: diet and lifestyle. Eat a diet rich in fruits and vegetables. Limit red meat and high-fat foods. Stay hydrated. Maintain a healthy weight. Exercise regularly. Don't smoke. Regular checkups. Men should discuss prostate screening with their doctor starting at age 50. Those with family history or other risk factors may need to start earlier. PSA tests and digital rectal exams can help detect problems early. Know the warning signs: difficulty urinating, frequent urination, especially at night, blood in urine or semen, pain or burning during urination, pelvic pain, Conclusion. What's the bottom line? The research suggests that regular ejaculation, whether through masturbation or partnered sex, may have some protective benefits for prostate health, but it's just one piece of a much larger puzzle. Your overall health habits, genetics, age, and regular medical care are far more important factors in maintaining prostate health than any single behaviour. The most important thing is to have open, honest conversations with your healthcare provider about your individual risk factors and screening needs. Remember, sexual health is part of overall health, and there's nothing shameful about these topics. If you have concerns about your prostate health or sexual function, don't hesitate to speak with a medical professional. Thanks for watching, and remember to like and subscribe if you found this information helpful. Drop your questions in the comments. I read every one, though remember this content is educational and not a substitute for professional medical advice. Note, this script provides general health information and should not replace professional medical advice. Viewers should consult healthcare providers for personalised guidance. See you in the next video.